Dear students, welcome to today's pathophysiology class osteoporosis. So osteoporosis, you can see in this basic slide, osteoporosis is a medical condition in which the bones become brittle and fragile from loss of tissue, typically as a result of hormonal changes or deficiency of calcium or vitamin D. So this is the definition of osteoporosis. Then again, osteoporosis is also defined like this: a disease characterized by low bone mass and structural deterioration of bone tissue. So, low bone mass and structural deterioration of bone tissue leads to bone fragility and susceptible to fractures. So, bones become brittle and they are susceptible to fracture easily. Commonly affected bones are vertebral column, rib, hip, and wrist. So, these are the mainly bones which are affected for fracture easily. Silent until a fracture occurs. So, anybody person who get fracture, then only we come to know he is suffering with osteoporosis. Until fracture happens, we can't identify osteoporosis is a slow process. Risk factors: non-modifiable factors and modifiable factors. So, two types of factors affecting etiology. Modifiable factors of osteoporosis: excessive alcohol. So, small amount of alcohol are probably beneficial. Bone density increases with increasing alcohol intake, but chronic heavy drinking alcohol decreases the bone density and increases the fracture risk. Second point is vitamin D deficiency. Low circulating vitamin D is common among the elderly people. Mild vitamin D insufficiency is associated with increased parathyroid hormone production. Parathyroid PTH hormone increases bone resorption, leading to bone loss. So you should notice here, bone resorption is causes bone loss. Next, tobacco smoking. Tobacco smoking has been proposed to inhibit the activity of osteoblast and is an independent risk factor for osteoporosis. Next, malnutrition. Identified risk factors include low dietary calcium, phosphorus, magnesium, zinc, boron, iron, fluoride, copper, vitamin A, K, E, C, D. So all these vitamin deficiencies and inorganic calcium salts deficiency causes malnutrition, which in turn affects the bone density. High dietary protein from animal source. High diet animal protein increases urinary calcium excretion, so thereby increases the fracture susceptibility to fracture. Next, underweight but inactive. So underweight person means the person is suffering with the bone remodeling. Remodeling will not be not proper, so due to some physical stress or physical inactivity, thereby the bone loss happens. So underweight person. Next, endurance training. So endurance means overtraining. In female endurance athletes, large volume of training can lead to decreased bone density and an increased risk of osteoporosis. So physical endurance, physical exercise, over physical exercise causes the loss of bone. Heavy metals. Low level exposure to cadmium is associated with an increased loss of bone mineral density. So bone mineral density increases with the very low concentration of cadmium, which is heavy metal. Then soft drinks. Studies indicate soft drinks may increase risk of osteoporosis, at least in women. Then protein pump inhibitor medicines. So protein pump inhibitors such as lansoprazole, omeprazole decrease stomach acid or risk for bone fractures. If taken for 2 or 3 more years due to decreased absorption of calcium in the stomach. So if any person is taking more protein pump inhibitors, then the calcium absorption decreases in the stomach. So I repeat all the factors, modifiable factors of osteoporosis: excessive alcohol intake, vitamin D deficiency, smoking, tobacco smoking, malnutrition, high dietary protein from animal sources, underweight person, endurance training, heavy metals like cadmium, soft drinks, then protein pump inhibitors. Next, non-modifiable factors of osteoporosis: bone density peaks at about 30 years of age. So maximum bone density will be 30 years. At the age of 30 years, bone density will be high. Women lose bone mass more rapidly than men. Osteoporosis increasing with age in both men and women. In female, due to estrogen deficiency following menopause or surgical removal of ovaries is correlated with a rapid reduction in bone mineral density. So bone mineral density decreases with the removal of ovary and in the menopause estrogen deficiency, due to estrogen deficiency. In men, a decrease in testosterone levels has a comparable effect on the osteoporosis. So if testosterone level decreases in the men, then osteoporosis occurs. Ethnicity. Osteoporosis occurs in people from all ethnic groups. So there is no particular ethnic group. All ethnic groups will get osteoporosis due to calcium deficiency. European or Asian ancestors are more susceptible. Hereditary. Those with a family history of fracture or osteoporosis are an increased risk. So they are having highly increased risk of getting osteoporosis. So you can see in the graph, so that blue area indicates it is decreasing bone mass with age in the male, whereas pink area, red area increases bone loss due to menopause. So with the age, bone density decreases. Here bone mass in the y-axis, x-axis age. So 0 to 100 years age is there, and 0 to 1500 bone mass is there. So we can see the peak bone mass is 30 to 40 years for male and female, but bone mass decreases rapidly for women than the men. Then you can see here fractures, aging, menopause, increased bone loss, other bone mass factors, low bone density, propensity to fall, fractures. Okay, so these are all the how one is correlated, all the factors correlated at the ending with the fractures due to osteoporosis. Then osteoporosis, diseases and disorders have been associated with osteoporosis. So the diseases in which the osteoporosis is reported. Immobilization causes bone loss. So if any person is immobilization, then bone loss is common. Hypogonadal states can cause secondary osteoporosis. Examples are Turner syndrome, Klinefelter syndrome, Kallman syndrome, anorexia nervosa, and andropause. Then endocrine disorders like Cushing's syndrome, hyperparathyroidism, hypothyroidism, diabetes mellitus type 1 and type 2, acromegaly, and adrenal insufficiency. So these are all endocrine disorders which are causing the osteoporosis. Malnutrition and malabsorption can lead to osteoporosis. Nutritional and gastrointestinal disorders. So the name of the gastrointestinal disorders in which the osteoporosis is occurring. Undiagnosed and untreated celiac disease. So celiac disease, symptomatic as well as asymptomatic patients. Then Crohn's disease, ulcerative colitis. So these two combinedly called as an inflammatory bowel disease, previously discussed in other video. Then cystic fibrosis, surgery of gastrectomy, intestinal bypass surgery, bowel resection, all this causes the osteoporosis. Severe liver disease, that particularly primary biliary cirrhosis. So biliary bile cirrhosis. These are all coming under the nutritional and gastrointestinal disorders. Then coming to rheumatological disorders, rheumatoid arthritis, ankylosing spondylitis, systemic lupus erythematosus, and polyarticular juvenile idiopathic arthritis. So all these diseases which are autoimmune diseases like rheumatoid arthritis, ankylosing spondylitis, systemic lupus erythematosus, polyarticular juvenile idiopathic arthritis are at increased risk of osteoporosis. Next, people with Parkinson's disease have a higher risk of broken bones. So this is also Parkinson's disease causing osteoporosis. Medicines associated with osteoporosis. That means the persons who are consuming following medicines will get the chances of getting osteoporosis is high. Glucocorticoids and anticonvulsants. So anticonvulsants means epilepsy treatment medicines. Glucocorticoids. Steroid induced osteoporosis SIOP arises due to use of glucocorticoids. L-thyroxine over replacement may contribute to osteoporosis. So L-thyroxine overuse. Anticoagulants, long-term use of heparin is associated with a decrease in bone density. Then proton pump inhibitors, previously discussed, calcium absorption decreases in the stomach. Then thiazolidinedione. So thiazolidinediones used for diabetes treatment. Example, rosiglitazone and possibly pioglitazone. So glitazone molecules. So rosiglitazone and pioglitazones are thioazolidinodiones used for diabetes treatments. These patients having increased risk of osteoporosis and fracture. Chronic lithium therapy has been associated with osteoporosis. So this lithium therapy they are using for the treatment of memory. So memory enhancing purpose. So due to chronic lithium therapy has been associated with. Then again, osteoporosis is also defined like this: a disease characterized by low bone mass and structural deterioration of bone tissue. So, low bone mass and structural deterioration of bone tissue leads to bone fragility and susceptible to fractures. So, bones become brittle and they are susceptible to fracture easily. Commonly affected bones are vertebral column, rib, hip, and wrist. So these are the mainly bones which are affected for fracture easily. Silent until a fracture occurs. So anybody person who get fracture, then only we come to know he is suffering with osteoporosis. Until fracture happens, we can't identify osteoporosis is a slow process. Risk factors, non-modifiable factors and modifiable factors. So two types of factors affecting etiology. Then the three main mechanisms by which osteoporosis develops are, so this is also coming under the pathogenesis of osteoporosis. Positive way. An increase inadequate peak bone mass. So first one is inadequate peak bone mass decreases. So due to this osteoporosis happens. Skeleton develops insufficient mass and strength during growth. So bone mass synthesis decreasing, first point. Second point, excessive bone resorption causes osteoporosis. Third factor is inadequate formation of new bone during remodeling. So remodeling time new bone formation is not proper, inadequate. Likely due to mesenchymal stem cells biasing away from the osteoblast and toward the marrow adipose lineage. Hormonal factors strongly determine the rate of bone resorption. Lack of estrogen as a result of menopause increases bone resorption, as well as decreasing the deposition of new bone that normally takes place in weight bearing bones. Hip bone, weight bearing bone is mainly hip bone. In addition to estrogen, calcium metabolism plays a significant role in bone turnover, and deficiency of calcium and vitamin D leads to impaired bone deposition. In addition, the parathyroid glands react to low calcium levels by secreting parathyroid hormone. So PTH, parrot hormone, is released due to the low calcium level, which increases bone resorption to ensure sufficient calcium in the blood. So to ensure sufficient calcium in the blood, PTH hormone releases. So example, this means low calcium level in blood. So then PTH hormone releases by the parathyroid gland. Then calcium from the bone moves back to the blood. Okay, resorption. This is called as a resorption. Movement of calcium from bone to the blood is called resorption. So then the bone calcium level decreases. Then bone becomes weak, which is causes osteoporosis and bone becomes susceptible to fracture. The activation of osteoclast is regulated by various molecular signals, of which rank L, a receptor activator of nuclear factor kappa B ligand. So rank L receptors molecules are associated with the activation of osteoclast, is one of the best studied method for the osteoporosis. So rank receptors are get activated by the activation of osteoclast, thereby the osteoporosis happens due to decrease in bone density. Then osteoblasts and osteoclasts inhabit the surface of bones. Trabecular bone is more active and is more subject to bone turnover and remodeling. So trabecular bone is the first bone which is undergoing remodeling due to decrease in the calcium, that is osteoporosis first reported in the trabecular bone. Not only is bone density decreases, but the microarchitecture of bone is also disrupted. The weaker spicules of trabecular bone breaks, micro cracks, that means micro cracks in the trabecular bone appears first when the osteoporosis happens in a person, are replaced by weaker bones. Common osteoporotic fracture sites: wrist, hip, spine. So spinal cord first, then hip rotation we call hip. Trunk, hip is nothing but trunk bone, so wrist rotation. And ribs are also susceptible to fracture easily then due to osteoporosis. Have a relatively high trabecular bone to cortical bone ratio. These areas rely on the trabecular bone for strength, so the intense remodeling causes these areas to degenerate more when the remodeling is imbalanced. Around the age of 30 to 35 years, cancellous or trabecular bone loss begins. So 30 to 35 years age, in between the trabecular bone density goes on decreasing. This shows your started osteoporosis started in your body. Women may lose as much as 50%. So 50% bone loss easily occurs in the women 30 to 35 years, whereas trabecular bone loss 30% in case of trabecular bone around 30 to 35 years age. So women are getting 30 to 35 years age, 50% bone loss in the trabecular bone, whereas in case of 30% osteoporosis in the trabecular bone in the age 30 to 35 years. Then diagnosis of osteoporosis. The diagnosis of osteoporosis can be made using conventional radiography, that means X-ray. So using the X-ray they can easily diagnose first by measuring the bone mineral density, BMD, bone mineral density considered for the diagnosing of osteoporosis. The most popular method of measuring bone mineral density is dual energy X-ray absorptiometry. So dual energy X-ray absorptiometry. Conventional radiographic techniques CT or MRI for detecting complications of osteopenia. Osteopenia is nothing but the reduced bone mass pre-osteoporosis. So before the person get osteoporosis, he will be suffering with the osteopenia. For differential diagnosis of osteopenia, follow-up examination in specific clinical settings such as soft tissue calcifications, secondary hyperparathyroidism, osteomalacia, and renal osteodystrophy. So these are all associated with the osteopenia. The main radiographic features of generalized osteoporosis are, that means in the bone what happens in the osteoporosis, that is radiographic features, that means X-ray features. Cortical thinning and increased radiolactancy. So radiolactancy increases and cortical thinning happens. These are reported in X-ray. Frequent complications of osteoporosis are vertebral fractures, for which spinal radiography can help considerably in diagnosis and follow-up. Vertebral height measurements can objectively be made using plain film X-rays by using several methods such as height loss together with area reduction. So height loss of the vertebral column and area reduction happens in the vertebral column, particularly when looking at vertebral deformity in T4L4. So T4L4 bone vertebral column deformity will be observed in the osteoporosis. Spinal fracture index that takes into account by number of vertebrae involved. Involvement of multiple vertebral bodies leads to kypnosis of thoracic spine, leading to what is known as Dowager's hump. That means hump like spinal cord get converted due to osteoporosis. That means bending, hump like bending of the spinal cord, that is due to kypnosis, bone loss, osteoporosis, T4L4 vertebral column deformity, and height of the spinal cord decreases, area of the spinal cord decreases. Dual energy X-ray absorptiometry, DEXA DEXA scan. So DEXA DEXA scan is considered by gold standard for the diagnosis of osteoporosis. So for the confirmation of the osteoporosis by the, that is a DEXA scan. Osteoporosis is diagnosed when the bone mineral density is less than or equal to 2.5. So 2.5 is there, means bone mineral density, then the person is suffering with osteoporosis. Below that of age 30 to 40 year old, healthy adult women reference population. This is translated as a T score. So this is considered as a T score. The World Health Organization has established the following diagnostic guidelines. Category T score range, percentage young women affected. Normal. So normal T score is more than or equal to -1. 85% women will be susceptible, normal in condition. Osteopenia. So -2.5 to -1. So -2.5 to -1, in between T score is there, means that is 14% women will get osteopenia at the age 30 to 40 years old. So here this factor, this T score is 30 to 40 years old women. Then osteoporosis. So if it is a T score is equal to or less than -2.5, 0.6% women. So 0.6% women will get the osteoporosis at the age of 30 to 40 years age. Then severe osteoporosis, T score is less than equal to -2.5 with fragility fractures. That means fracture is already there, reported, that type of women. So normal person, osteopenia, then the primary severity is osteopenia, then osteoporosis, then severe osteoporosis. Thank you.